Have you ever stopped and thought about this? You breathe about 20,000 times every single day without even thinking about it. But what if suddenly breathing became difficult? What if climbing just one flight of stairs made you gasp for air? What if a simple cough turned into something life-threatening? Many people assume lung diseases happen only to smokers or elderly people. But here is the shocking truth. Even children, young adults, and non-smokers are developing respiratory illnesses today. Pollution, infections, lifestyle habits, even the air inside our homes can slowly damage our lungs. So the question is, are you really protecting your lungs? Today, we are going to talk about everything you need to know about respiratory health, how your lungs work, what diseases affect them, how to prevent them, early warning signs, home care for common symptoms, vaccinations, treatments, and some myths that many people still believe. And by the end of this video, you might look at your breathing very differently. Let me tell you about Joseph. Joseph was a 7-year-old mechanic. Every morning he had a cough, thick mucus, breathlessness while walking, but he ignored it. "It's just my smoker's cough," he used to say. One winter morning he woke up unable to breathe properly. His family rushed him to the hospital. Doctors diagnosed him with COPD, chronic obstructive pulmonary disease. Years of smoking and dust exposure had damaged his lungs. Now, let me tell you another story. 6-year-old Ria suddenly developed a strange barking cough in the middle of the night. Her parents panicked. They thought she was choking, but the doctor explained it was croup, a common viral respiratory illness in children. Two completely different people. Two very different conditions. But one important lesson. Respiratory health affects everyone. How the respiratory system works. The respiratory system includes the nose, throat, voice box, windpipe, bronchi, and lungs. Inside the lungs are millions of tiny air sacs called alveoli. These tiny sacs perform a life-saving function. They allow oxygen from the air we breathe to enter the bloodstream and remove carbon dioxide from the body. In simple words, your lungs are constantly exchanging gases to keep every organ alive. But when something interferes with this process, infection, inflammation, blockage, fluid, or tumor, breathing becomes difficult. And that's when respiratory disease begins. Let's briefly look at some common respiratory conditions. Asthma, a chronic disease where airways become inflamed and narrow, causing wheezing and breathlessness. COPD, a progressive lung disease usually caused by smoking or long-term pollution exposure. Bronchitis is inflammation of bronchial tubes leading to cough with mucus. Pneumonia, a lung infection that fills air sacs with fluid. Tuberculosis, a bacterial infection affecting lungs and spreading through the air. Allergic rhinitis, frequent sneezing and nasal congestion due to allergens. Allergic rhinitis, frequent sneezing and nasal congestion due to allergens. Croup, a viral infection in children causing a barking cough. And then there is a disease many people fear. Lung cancer. A brief word about lung cancer. Lung cancer is among the leading causes of cancer deaths worldwide. The biggest risk factor is smoking. But here is something many people don't realize. Even non-smokers can develop lung cancer due to pollution, secondhand smoke, and occupational chemical exposure. Early symptoms can include persistent cough, blood in sputum, chest pain, unexplained weight loss. But sometimes early lung cancer has no symptoms at all. That's why persistent cough should never be ignored. Now, let me ask you a question. How many of these risk factors are part of your daily life? Smoking, secondhand smoke, indoor smoke from cooking fuels, mosquito coils and incense smoke, outdoor air pollution, dust exposure at workplace, repeated respiratory infections, poor nutrition, lack of vaccination, obesity, poor ventilation at home. Many people think pollution outside is the biggest problem, but sometimes indoor air pollution can be even worse. Vaccination, a simple yet powerful protection. Vaccination is one of the most effective ways to prevent severe respiratory infections. Vaccines train the immune system to recognize harmful organisms and fight them before they cause serious illness. For children, important vaccines include BCG for tuberculosis, DPT for whooping cough, measles vaccine, influenza vaccine, pneumococcal vaccine. Adults also need protection. Annual flu vaccine is recommended especially for elderly people and those with chronic illnesses. Pneumococcal vaccine protects against serious pneumonia. COVID-19 vaccination reduces severe respiratory complications. Vaccination not only protects you, but also protects your family and community. Daily habits that keep your lungs healthy. So what can you actually do to protect your lungs? Important, first and most, avoid smoking completely. There is no safe level of tobacco exposure. Improve air quality at home, ensure proper ventilation, avoid burning waste indoors, reduce use of incense sticks and mosquito coils. Regular physical activity is also important. Even 30 minutes of walking daily improves lung capacity. Breathing exercises are another powerful tool. Pursed lip breathing helps reduce breathlessness. Diaphragmatic breathing improves lung expansion. Yoga breathing practices such as Anulom Vilom and Brahmari help improve oxygen flow and reduce stress. Healthy nutrition also matters. Fruits, vegetables, protein, and adequate fluids support lung health. Maintain healthy body weight. Obesity restricts lung expansion, while malnutrition weakens respiratory muscles. And something very simple but very powerful: hand washing. Regular hand washing prevents many respiratory infections. Another simple habit is coughing etiquette. Cover your mouth with your elbow while coughing and properly dispose of tissues. Small habits can prevent infections from spreading in the community. Environmental precautions. Clean air is essential for healthy lungs. Practical steps include wet mopping instead of dry sweeping, regularly servicing air conditioners, using exhaust fans in kitchens, keeping windows open for ventilation when possible, avoid overcrowded spaces, and, whenever possible, support initiatives that improve air quality and plant more trees. Clean air benefits everyone. Recognizing common respiratory symptoms. Now let's talk about symptoms people commonly experience. A cough can be dry or with mucus. Warm fluids, honey, and steam inhalation may help mild symptoms. But if cough lasts more than 2 to 3 weeks, medical evaluation is necessary. Sore throat. Warm saltwater gargles and hydration usually help. Running nose, often caused by viral infections or allergies. Saline drops and steam inhalation can relieve symptoms. Wheezing, a whistling sound while breathing often seen in asthma. Sit upright and use prescribed inhaler if needed. Croup in children. This causes a barking cough. Keeping the child calm and upright often helps. Chest tightness may occur in asthma or anxiety. Excess mucus, hydration, and steam inhalation help loosen secretions. But if mucus contains blood, immediate medical attention is needed. Home remedies for symptom relief. Some simple home remedies may help mild symptoms. Warm saltwater gargles, steam inhalation, honey for cough in children above 1 year, ginger tea, turmeric milk, warm soups, and plenty of fluids. These remedies provide comfort, but should not replace medical treatment when symptoms are severe. Role of over-the-counter medicines. Some medicines available without prescription may help temporarily. Paracetamol for fever. Saline nasal sprays. Mild antihistamines for allergies. However, avoid unnecessary antibiotics and prolonged use of nasal decongestants. If symptoms persist, medical consultation is important. Diagnostic tests for respiratory illness. Doctors may recommend several tests to identify respiratory problems. Chest X-ray, CT scan, pulmonary function test, spirometry to diagnose asthma or COPD, peak flow meter for monitoring asthma, sputum test to detect infection or tuberculosis, pulse oximetry to measure oxygen levels, bronchoscopy to examine airways. Early diagnosis helps prevent complications. Treatment options available. Respiratory illnesses are treated using several approaches. Medications such as bronchodilators, inhalers, steroids, and antibiotics. Nebulization therapy. Oxygen therapy when oxygen levels fall. Non-invasive ventilation such as CPAP or BiPAP. Mechanical ventilator support in severe cases. And in extremely critical situations, ECMO, an advanced life support system that temporarily takes over lung function. Pulmonary rehabilitation programs also help patients improve exercise tolerance and quality of life. Myths and facts. Let's clear some common myths. Myth: only smokers develop lung diseases. Fact: pollution, infections, and occupational exposures can also damage lungs. Myth: inhalers and nebulizers cause addiction. Fact: they simply deliver medication effectively to the lungs. Myth: steam inhalation cures pneumonia. Fact: steam may relieve congestion but does not cure infection. Myth: vaccines weaken immunity. Fact: vaccines strengthen the body's defense system. Myth: green mucus always means bacterial infection. Fact: viral infections can also cause colored mucus. Myth: oxygen therapy causes dependency. Fact: oxygen supports the body when levels are dangerously low. Warning signs you should never ignore. Seek medical care immediately if you experience severe breathlessness, chest pain, blue lips or fingertips, persistent high fever, blood in sputum, confusion, difficulty speaking due to breathlessness. These signs may indicate a serious medical emergency. Let me ask you one final question. When was the last time you actually thought about your breathing? Your lungs work every second of your life. They never take a break. They never ask for attention until something goes wrong. And when breathing becomes difficult, nothing else matters. Protect your lungs before disease begins. Avoid smoking. Keep the air around you clean. Stay active. Eat healthy. Get vaccinated. And never ignore persistent respiratory symptoms, because the most valuable thing we take for granted is the very breath that keeps us alive. Take care of your lungs, because every breath matters. Before you go, if you found this video helpful, please share it with your family and friends. Someone out there might learn something today that could protect their lungs tomorrow. And if you want more simple, evidence-based health information, make sure you subscribe to my channel at Scariva and turn on the notification bell so you never miss an update. Stay healthy, stay informed, and remember, every breath matters.